The academic journal I chose is Nephrology Nursing Journal. My field of study is nephrology. Nephrology is a study of anything pertaining to the kidneys, like its functioning and malfunctioning. The journal I'm publishing is for the Nursing Nephrology Journal. Their focus is to help inform those who are planning to become nurses of nephrology or those who are already nurses of that field, to inform them about different situations that occurs in that area or enhance their nursing skills. The Nephrology Nursing Journal helps inform or educate nurses and or future nurses about kidney disease so they can be able to tackle any obstacles that may derive from kidney disease. Their journal is highly detailed when explaining other people's conducted experiments. With that being said, most of their articles are informative and research synthesis based. The journal is pure of observations and research along with illustrations of data, facts, and logical statistics. Language tends to be complex at times, but the authors tend to clarify or elaborate what they mean. This is also found in descriptions under charts and tables. There have been several occurrences where authors keep clarifying on the same subject, making it feel like they are repeating sentences over and over, but just in a slightly different way. The text as well as the charts and graphs are highly detailed. Topics are kept alive and keep the audience engaged. Research-based questions are discussed, experiments are observed, and come to conclusions of how and why they are relevant in nephrology. The main claims are located in the first paragraph on the top left corner, which is the abstract. Format is methodological. Articles are organized in an informative and research synthesis type of format, along with the problem-solving criteria. Articles have a compare and contrast type of organization. Thesis statements are clearly stated in the introductory paragraphs and clearly restated in conclusions. Observational and research support is given through text and illustrations which contain facts and statistics on charts and graphs. Support is given in chronological order. After the introductory paragraph, the format goes from methods to results, which include data displayed in text and visual charts and graphs. Sources are cited in APA format. Interviews, research, and secondary sources are cited in the articles in the text, mostly paraphrased, and it also contains a reference page or pages. Charts and graphs are illustrated using research that are discussed and observed. Persona is intellectual. The relationship the author has with the audience is professional. The primary purpose of the journal is to give an informative analysis of problems that are faced in the medical field, in particular nephrology. Tone is formal. They don't use contractions. Language is a bit complex, mostly because it tends to be medical terms. Analysis is given in third person. Sentence and paragraph length is not too long. Explanations and observations tend to be long-winded because they elaborate on what they are discussing, which is a good thing. I planned to write an informative explanatory synthesis paper on how peritoneal and hemodialysis affects kidney failure patients physically, mentally, and socially within their family and friends. This issue is relevant to fellow scholars in my field of study because investigating what is underneath this issue may help provide more information which can hopefully lead to possible solutions that can try to cope or control the physical, mental, and social problems peritoneal and hemodialysis patients go through in some cases on a daily basis. Additionally, many suffer from kidney failure, and so it is only right that we provide patients as such with an abundant variety of information as we try to care and support them. Writing conventions used were research synthesis, organization, compare and contrast organization, facts and statistics support, secondary sources research, intellectual persona, professional persona, informative analysis, organization, formal tone, somewhat complex language, third person style, not too long sentences, elaborate style, subtitles. I chose to use these writing conventions in order to meet most of what they require in their journal so it can feel consistent to what is already published. Writing conventions not used: charts and graphs support, engaging style, methodological organization, chronological organization, APA format, and interviews. I chose not to use these writing conventions because I did not conduct my own experiment. I just gave an informative research analysis. I chose to use academic journals for my research. The 6 sources I chose were as follows: International Journal of Nursing Practice, Renal Failure, Journal of Clinical and Diagnostic Research, Saudi Journal for Health Sciences, Quality of Life Research. All authors credited in my research paper had some type of medical field experience. All authors gave an analysis of data gathered from surveys given to peritoneal and hemodialysis patients. Each author gave a comparative analysis on PD and HD patients' quality of life. The purpose of this informative explanatory synthesis paper is to provide a comparison of PD and HD patients' physical, mental, and social health using data from 6 different studies conducted by medical professionals. Peritoneal dialysis or hemodialysis are formed as a type of treatment and may be in some cases the only treatment to help the kidneys function as patients try to embrace the fact that they are at the end stage of renal disease. Among surveys that were conducted to PD and HD patients by professional practices, their main goal was to compare the results from the surveys into a detailed analysis discussing the similarities and differences that of PD and HD patients by analyzing their QOL, quality of life. Overall, peritoneal patients have better quality of life when it comes to physical, mental, and social health, according to the gathered data from 6 different analysis studies. Here is a visual of what PD and HD patients go through and what it affects. Around the world, there are many people who undergo dialysis. Seeing that this is the case, that means many people's quality of life is getting altered due to their treatment. Helping these patients get the best quality of life may enhance their survival or just enjoy life like those without kidney failure. Every dialysis day they have to endure affects their quality of life, and making life better for these patients will not only help them but also those people around them as well. These people include those who assist on their dialysis treatment and most importantly their family and friends. For patients who have low physical function to move around and visit friends but want to maintain their social and mental function, family and friends should try to visit them instead. Also, those who assist in their dialysis treatment whenever there is free time should embark in a conversation comment or compliment their patients as often as possible to boost their social or mental function. Finally, friends and assistants should try to motivate their patients to move around or exercise with something so simple such as playing with the stress ball in order to get their physical function levels higher. If nothing is done, not only will these patients have a poor quality of life, but they also may have lower expectations to live. If all is done, these patients may have a better quality of life and hopefully live longer and stronger.